forget. Okay. So let's give it maybe 2 more minutes and then we'll go ahead and get started. Okay, and Melina sent it out to Big Sandy. Thank you, Melina. Let me check my email.
If y'all can hear my music, that's a good thing. It's classic rock and roll Friday for Mountain Comp people here in this office.
Love it.
It's got a mind of its own, though. It goes up and down on its own. Vanessa, you don't appear to be on vacation.
Well, I am. I am about 8 minutes from the beach. And after this meeting today, that's where I'll be headed. So I'm at my mom's house. Me and my sister and my aunt flew down to see her. And my stepsister was supposed to join us, but her flight got canceled after she got to the airport in Knoxville last night. So lots of flight cancellations going on these days.
Jeez.
All right. Well, it is 10:07, so we are going to go ahead and get started with our presentation today. Good morning and welcome to everyone. This is the RIAC Learning Series, and my name is Vanessa Brewer. I am the Regional Interagency Council Program Administrator, Regional Interagency Council, also known as RIAC. I work at the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And my co-host today is Stephanie Sykes-Jones, and she is the Tailored State Level Youth Coordinator, and she also works at the Department for Behavioral Health, Developmental, and Intellectual Disabilities. So if you've not attended before, the RIAC Learning Series was created as a response to evaluations that we received from a RIAC workshop that we did last winter. Several topics were listed as needing more information to support the work of RIAC and system of care efforts. So all topics are RIAC driven. And these learning opportunities are offered on the first Friday of the month at 10 a.m. Eastern Standard Time. They're free. And we try to keep them to just an hour to an hour and a half, just to respect everyone's time. Our presentation today, whoops, sorry guys, my screen is doing something really weird. Hold on just a second. Oh, hold on. Sorry about that. Our presentation today is engaging and partnering with local political leaders, and our speakers are Dr. Sheila Schuster and Liz Moreland. Dr. Schuster is a licensed psychologist and a mental health advocate who has spent more than 4 decades of work in Frankfurt to improve services for persons living with mental illness and other disabilities and to increase access to healthcare across Kentucky. Dr. Schuster leads the Advocacy Action Network, which is an umbrella organization that includes groups addressing healthcare, mental health, and social justice and disability issues. She also chairs Kentucky Voices of Health and leads the Kentucky Mental Health Coalition. She chairs the Behavioral Health Technical Advisory Committee to the Kentucky's Medicaid program as well. Dr. Schuster is a frequent presenter of advocacy training for a variety of audiences and issues, with the goal of helping those who wish to raise their voices to become more effective advocates. Her advocacy efforts to improve the quality and availability of healthcare, including mental health services in the Commonwealth, have been recognized with her induction into the U of L College of Arts and Sciences Hall of Honor, the UK College of Public Health Hall of Fame, and the awarding of an honorary doctorate of public health service degree by Spalding University. We also have Liz Moreland with us. Liz Moreland is the local resource coordinator for the Bluegrass Regional Interagency Councils, which includes Bluegrass West, South, and East, as well as 2 local interagency councils, which are Clark and Jessamine counties. Liz's credentials include a Bachelor of Science in Psychology and a Master's in Public Administration. Liz has a background in child welfare and has been an employee of the New Vista Community Mental Health Center for 22 years. Her most recent role as the local resource coordinator has allowed her to interact with several different community partners, including collaboration efforts with public, private, and nonprofit organizations, as well as political leaders in many different areas. So before I turn it over to Dr. Schuster and Liz, I wanted to share a few netiquette housekeeping items. So if you haven't already, please mute your mics. If we have any issues with our internet, we might have to turn our cameras off too. Just to let you know, this workshop is being recorded and it will be archived on the RIAC webpage to use as a resource and to share with others on your councils that maybe couldn't attend today. So I can put that link of the webpage in the chat box. You may use the chat and Q&A box for questions, and Stephanie and I are going to be monitoring that during this learning opportunity. We've got some time carved out at the end for question and answers as well. So if you've got those, you can ask at the end. And if you need a certificate of attendance, those are available upon request. Just email me and I'll put my email in the chat box as well if you don't have it already. So please join me in welcoming Dr. Schuster and Liz Moreland.
Thank you so much, Vanessa. I'm thrilled to be here to talk to the RIACs and other folks that are interested in honing their skills as advocates and focusing on local political leaders. So if you'll go to the first slide, please.
People to let me change it here.
Well, maybe. Oh, yeah, there we go.
Okay.
Okay. So just a reminder of your Civics 101, maybe you took in middle school or in high school, and that is that a democracy requires that the voice of the people be heard. So this is to remind you all that our government and our policies are only going to happen if we raise our voices. This is a picture of one of our 874K Disability Coalition meetings, and all the folks there on the stage are self-advocates. They're all people with disabilities who come forward to tell their stories. We have 874,000, more than 874,000 Kentuckians who have a disability. And I always tell them that if every one of them registered to vote and raised their voices, they would be the largest voting bloc in the state. So next one, please. So this is kind of my guilt slide a little bit. If policies are going to be made, whether you're engaged in the process or not. So you can decide to stay on the sidelines, or you could choose to try to influence the system. For those of you who are therapists, you know that a client can come in and tell you over and over again about the same situation. And you can say to them, well, you can either decide to be a victim, so to speak, of that situation, or you can decide to do something about it. So I think all of us need to be advocates, and we all need to be engaged in trying to influence whatever system it is that is creating policies that affect us and our families, our communities, and certainly the people that you serve through the RIACs and other opportunities. Next, please. So this is one of our 874K gatherings when there was still a convention center in Frankfurt. It's now rubble and being turned into something else, but we would have 1,000 people with disabilities there and invite their legislators over. And I guess the question I would ask of you, if you don't speak out, who will speak? So who understands the issues, and the issues in this case for kids and their families better than you do, and whose voice do you want to be heard? So I think that advocacy is all about making our voice heard. Next, please, Stephanie. Thank you. So this is the Sheila Schuster definition of advocacy. You can look it up and get lots and lots of different definitions, but I call it education with passion. There are lots of things that we do as an advocate, the most important of which is that we have passion about our mission, whatever that mission is. And I always say to people, you know, I can't make you be passionate about the same things that I'm passionate about, but I know that you are passionate about something or some things. and some groups of people. And so that's what will make you a good advocate. The fact that you are working with kids and families in your work, I think it's impossible. I think I was a child psychologist for 27 years before I started working with legislators. And I think it's impossible to work with kids and families and not be passionate about the situations they find themselves in and our need to help them do something about it. So what are the characteristics of a good advocate? An advocate listens. So you have opportunities to listen to the kids that you're trying to help and to their families and to everybody that's kind of joined with those kids at the hip, as I call it. So the school people and the maybe the court system, the community resources and so forth. You want to connect. And that's the beauty, I think, of the SEAC and the RIAC. You all are just hubs. You are absolute connectors, as we call them. And so you're trying to bring everybody together with a single voice about single issues and trying to, in the process of that, listen to what each is offering to you and trying to connect so that your voice is stronger. You have to be willing to speak out, and you could speak in a loud voice. I've been known to yell in the rotunda because the acoustics are so bad when we have 700 or 800 people there, or you can speak softly, but you have to speak up to the people that are in power about what people need. Then you need to be willing to act. An advocate, I think, cannot sit on the sidelines and hope that somebody else will do it. An advocate has to be the person that steps forward and takes that action. So in general, an advocate has passion about an issue or about people. And I'm sure that everyone who's on this call is on it because of your passion for the kids and families that you serve and passion about the issues. Yes, the next slide, please. So what do you bring to it as a RIAC member? And I know we may have some other people who are not RIAC members, but I think we all bring these same characteristics. So you understand it's about the kids and not about politics. Right now we're in the COVID crisis and it's all gotten very political about whether people are going to wear masks or people are going to get vaccinated. And I think we do better if we stay out of the politics, but stay focused on the kids. And that's sometimes it's hard to do, but I think as long as what you are saying or doing comes back to what's best for the kids that you're trying to serve, then you're doing it well. You're willing to get involved in advocacy. I assume that nobody twisted your arm and said you had to come to this learning series to learn to be a better advocate. So I'm going to assume that you have a real interest in that. And after you listen to Liz later, I think you'll be really energized about what some of the activities are that you can do locally. You're knowledgeable about your issues. So don't ever underestimate how much you know about what's going on policy-wise and program-wise for kids. And very often we assume when we're knowledgeable that everybody we're talking to is knowledgeable, which is absolutely not the case. I'm in Frankfurt and most of my work is done at the state level. And I always have to remind myself not to assume that the legislator that I'm speaking to knows who a psychologist is and how they're different from a psychiatrist or other mental health professionals, that the legislators or policymakers understand about mental health and social determinants of health and some of the things that we talk about all the time. So stop and think when you're getting ready to talk to somebody in your local community, how can you translate what you know about the issues into something that is easy for them to understand and take notice of? You want to provide accurate information. And quite frankly, I've done, I can't tell you how many of these advocacy workshops. And when I tell people, reach out and talk to your fill in the blank, your federal legislator, your state legislator, your local council member, your local mayor, there's a little bit of anxiety on the part of people about doing that. And the biggest source of that anxiety, I think, is that people will say to me, well, what if they ask me a question and I don't know the answer to it? Or what if they ask me something about the policy and I don't know that answer? I think you have to look at that as a wonderful opportunity to have what I would call a second bite at the apple. Instead of staying away from the interaction because you're afraid that you might not be able to answer it, you want to go in there with as much information as you can. But if they ask you a question and you don't know the answer, it's a great opportunity to say, that's a great question, and I don't have an answer for you right now, but I will get you an answer. And what's the best way for me to be back in touch with you with that information? Whatever you do, don't pull it out of your left ear. Don't make up something. You might have been the best BSer in college and make up answers to questions and so forth. You don't want to ever give iffy information to a policymaker because it will really ruin your credibility. And really all you have to sell is your credibility. So if they ask you a question and you don't know the answer, say, I'm not sure about that answer. Let me get it for you and let me get back in touch with you. And then be sure that you do it. You want to have a reputation with your local policymakers that they can rely on you, that when you say you're going to get something together or you're going to get them some information, that in fact you get it. But again, it gives you an opportunity to say, what's the best way for me to get it back to you? And a lot of times the policymaker will say, well, just send it to my private email, or here's my cell phone number, or here's the person that I work most closely with, or it gives you an entree back to that person. You can access free media. I've never had the pleasure or the burden of working with anybody who had enough money that they could buy media. In other words, a budget for just doing nothing but generating media. So think about what's being covered in the papers and the newspapers, on your local television and radio, and it's almost always focused on people. You all have people. You have people with stories. So that's the way that you get free media attention. Obviously with the permission of the children and their families or guardians and so forth, but do they have a story to tell? Is there a story you want to put out there about an event that you're offering? And you will get media attention. It's a lot easier with kids, let me tell you, than it is with some of the populations that I work with, like adults with serious mental illness or adults with substance use disorders. Kids are a natural draw for media. So think about that. You can rally grassroots support, and we're going to talk more about forming coalitions and reaching out and getting more people to work with you and support what you're doing. And you can gather allies to work on your team. So the RIACs and the SEAC are set up so beautifully to bring everybody together at a kind of a primary level. But then think beyond that. Who's not at your RIAC on a regular basis that would really be helpful to have and to invite? Next, please. So let's talk about the context, because we're, as you know, have been in the pandemic. And I think there's never been a time when there's been more discussion about mental health than there has been during this pandemic. So one of the good things that's happened, even though there's been so much suffering and so much loss, is that there's a lot of focus on mental health. So I have a psychologist friend who wrote a wonderful op-ed, and she called the COVID-19 time the trifecta of anxiety. So you have an unknown duration or unknown period of time. You have a complete loss of control, which is so incredibly anxiety producing for most of us. And then you have the sense of great risk, and that risk could be physical, mental, social, economic. And all of that is coming together in this COVID-19 pandemic time. So I think we need to acknowledge that all of us are suffering, whether we feel it and express it. We all do that differently, but we know that anxiety and depression are the most common symptoms in all age groups, but particularly including children. And now we're at a really strange time. Before the Delta variant raised its ugly head, we were thinking we were at the, saw light at the end of the tunnel. And we had both relief and anxiety, but we still had questions about safety, about vaccinations, about protocols. There's a lot of talk about returning to normal, except do we really want to go back to where we were? Was that really normal? What are we going to be dealing with? And we're going to be dealing with these uncertainties, I think, not only in the months ahead, but I'm predicting for the next 4 or 5 years. I think it's going to take that long for us to really sort out, and particularly with kids. You think about the kids that are socially anxious and have probably been very happy to be at home during this time, the kids that were bullied at school or didn't feel like they fit in, and now they have to go back and face it. We also have the kids that were enduring a lot of hell at home during this time, with domestic violence up, with child abuse up, with substance use disorder up. So we're dealing with some very fragile people, including ourselves at this time. Next, please. So with school reopening, we're going to be focusing on students, their families, and communities. And let's remember that teachers and school staff and administrators have been dealing with this. I have a niece who teaches in Jefferson County Public Schools in elementary. If you could imagine teaching art, K-5 via Zoom, you know, the stress on her to try to translate her lessons and make them doable for kids even that young on a Zoom platform. So she was dealing with her own level of stress. We also have to acknowledge that many Kentucky communities have been dealing with racial injustice and racial trauma, and those are unresolved issues. Remember that your Kentucky schools, each one of them, have recently developed and publicized their trauma-informed school plan for this year. So each school is going to have their trauma-informed team and their plan. So you have that to kind of hook your hat to, in a sense. What is it that you can do that they're working on that mirrors what you want to do with your RIAC? So I think this is a wonderful time to advocate and educate, particularly around mental health. I think this is a great time to talk about mental health needs for all kids, and particularly those kids who have been identified as having special needs. So there's a lot of opportunity, I think, you know, with crisis always comes opportunity. So I think this is a great time coming back, even though there are a lot of unknowns. It's a great time to focus on mental health. Next, please. So as a member of the RIAC community and being a passionate educator, remember that you understand the kids that you're working with and their needs. You're willing to advocate to get their needs met. You're knowledgeable about your community, and Liz is going to talk in a few minutes about some wonderful ways to get to know your community even better. We want to encourage kids and families to be what we call self-advocates. You know, nothing is more empowering than encouraging someone who thinks they don't have a voice to speak up and find out that they do have a voice. I can tell you many wonderful stories of bringing consumers of mental health services to Frankfurt and having them testify or make a statement at a regulation hearing, and being so scared that they literally were shaking. And I began to wonder whether, as a psychologist, I was creating more anxiety than I was dealing with. And then afterwards, they wanted to know when they could come back and do it again. It felt so good to be willing to step forward and to tell their story or to speak up to a policymaker. And you could gather and work with others, because that's the very nature of the RIACs. Next, please. So within your community, where can you lift up the voices of those young people? What are the opportunities for them to speak out, or for you to speak out for them and kind of model that behavior? So the young people and their families. What education do you do in with your local politicians and community leaders? What do they need to understand about young people and what they need to be successful? How can you work to get a whole chorus of people, not only the young people, but the parents and teachers and community partners, in saying what changes are needed? And then how do you bring together those voices to help create changes that will improve the lives of those young people? So let's go to the next slide, and then we'll hear from Liz after this. So think about this. This might be a good exercise for your RIAC. What would your community look like if it were fully supportive of each child and responsive to their needs? How would it be different if it was really geared, if your immediate community was really geared to meet children's needs, as well as those of parents, teachers, youth workers, and others connected with kids? I think it's helpful to go through exercises like that and even to lay out a description of what your community has been like in the past and how it would change if it were moving toward being more supportive of young people and those who are supporting them. And then how can you and your colleagues learn from community leaders, how they see the community and what changes need to be made to be more youth supported. So I'm going to turn it over to Liz now, who is a great example of how Bluegrass West RIAC did exactly that thing. So Liz, take it away.
Thanks, Sheila. We wanted to, we've actually reached out in the West RIAC to our political and community leaders in the 7 counties that the West RIAC covers. One of the things that we decided we needed to do, as Sheila had mentioned previously, one of the main parts of being an advocate is to listen. So we invited the political leaders, mayors of several different towns there in the West to come to a meeting. So we wanted to send this survey out to them first, one, to kind of get an idea from them what they saw was happening in their own communities and with their constituents, the youth and families there in their own towns. And we also wanted to put these questions out to sort of serve as a discussion start, so where we could have different points to discuss with them when they did come to the meetings. So this is the survey. We actually had youth and parent reps help with some of these questions because we wanted to include their thoughts as well and even getting this information from the political leaders. So the first one here is, what do you see as your community's greatest strengths? Are there existing community programs, services, and resources that the RIAC can help support? This was really important because we know that our work really, we try to make it strength-based. And if there are already existing programs, as many people say, you don't want to reinvent the wheel, but we were lucky enough to have some funding. So we really wanted to make sure we were good stewards of the grant money and try to implement programs that we could help even support existing resources and build on the work that those communities have already been doing. The next one is that the RIAC may be able to assist with some amount of funding to help promote and or develop resources for youth and families in your area. What types of services, projects, community events, et cetera, do you believe would be helpful and most beneficial for youth and families? This kind of captured a little bit of both, in that if they already did have some existing resources and services, we could help build on that. But we also wanted to get an idea of the barriers that they saw in their communities. And they may have a lot more insight into their own community, even outside of what youth and families may be aware is happening, and how the funds that we would be able to use to support the projects and implement projects would work best. The next one is, what barriers are preventing the youth and families in your area from being healthy, productive, and successful? Which again kind of goes along with, we're delving a little deeper into what they see is the very difficult problems that their youth and families may face in their own community. And then, are there any areas of focus that you believe are most prevalent for the youth and families in your community? What are the greatest needs in your area? Stephanie, if you don't mind to scroll down, please. The next one is, how has COVID-19 affected the families in your community? Are there needs specific to the pandemic that we may be able to address? And as Sheila went over, we saw a huge increase in, unfortunately, youth suicide risk, substance use, domestic violence, child neglect, and even a lot of that probably went unreported because everyone was so isolated. And we know that looking back, the youth and the families in these communities really struggled a lot with people losing their jobs. So we had, increased poverty, just a lot of different barriers and issues that came from COVID-19. And we were lucky enough to get some grant funding from the COVID-19 grant that a lot of you all are familiar with. And so we were able to support them in that respect. But it's long-term and it's ongoing. So we need to continue those efforts. So we really wanted to talk with them to see how it's affected. And it probably has affected different communities very differently as well. Some communities in the West RIAC are larger towns, so they have a higher amount of services that they already in place for them. Some didn't. Some didn't have very many resources at all available. So that's why we wanted to include not just the mayors and the contacts, political leaders from the larger towns. We really invited all of them. We even invited, if we struggled to reach out and get feedback from mayors, although we did invite the mayors from all of the counties, or cities, the larger cities in the counties. We also did have some feedback from them, so we expanded it to city council members. So one thing to remember, I think, and that I learned during this process was that there are more political and community leaders to reach out to than just the top of the, of the chain there. We really researched and we contacted a lot of different community leaders, and leaders within the faith-based community were very helpful. So don't just limit your advocacy or your community outreach to one or two folks. Really look into, and you can go to, most of the communities have city websites, county websites, and you can get a lot of information about really good contacts through the government websites in towns and cities and counties. So I would really recommend that. And then would it be possible to hold in-person gatherings such as outdoor resource fairs or other community events with safety guidelines in place? Over the past year, I know that all of you all have struggled, as we have, our RIAC, in trying to do things virtually. There was a lot of virtual burnout. But because we reached out to them, we felt like that they would have a better answer because of the uncertainty also that Sheila had mentioned. We are just kind of struggling still day by day to try to figure out how best to reach the youth and the families. Is it safe to hold in-person events still? And a lot of people are going back and forth with the new Delta variant. And so it's really been a struggle trying to figure out how to move forward. And by reaching out to the political leaders, they had a better idea of their individual communities and towns as to where they are with safety protocols, which areas in the community may be the safest to hold these types of events, and just get some really good information and guidelines from them about how we can work to start opening things back up for the youth in a way that will be safe for youth and families. And then the last one we put on here is, would your office or agency be interested in joining the West RIAC on a regular basis? This was really helpful to have included on the survey. And I will tell you that we did gain a couple of community partners who really, they had heard of the RIAC, but they weren't super familiar with our work. And by completing the survey and coming to our meeting, we made some really good connections, and even some folks who said, yes, they would really like to be a part of the RIAC because they saw what type of work we're doing, the goals that we have, and they were really interested in being a part of that. So it's definitely a great tool. The survey, sending that out and inviting them to your meetings is a great tool to gain a lot of knowledge and information and listen to the folks who have really in-depth information about their own communities.
Liz, did you do the survey in writing with people, or was some of it done, almost in an interview, face-to-face or over the phone?
We did it. Yeah, we did it virtually. Some of it we did through just emailing it out to the contacts that we had invited. We were going to try to do a digital survey, but we felt like with the number of people that we were having, it was going to be easier to just send it out to them directly. Plus, it gave us another way of explaining who we are and reminding them, hey, we're really wanting you to come to our meeting. If you could research this a little bit and maybe come prepared to discuss some of these topics. So we just sent it out virtually, and then they, when they participated in the actual meeting, which again was virtual, we went through the survey line by line and discussed each point. So most of it was done pretty much virtually.
Yeah, but it gave you a great opportunity to educate people about who you were, right?
Exactly.
What the RIAC,
Yeah.
the RIAC existed,
Yeah.
who was on it, what your goals are, and so forth. So it was a
Right.
great
Yeah, we were
tool.
able to share the work that we're doing, the projects we were hoping to, the goals we were hoping to accomplish, and how we could work and collaborate with them. And we had a lot of really good response from them.
Yeah. Did you reach out to other nonprofits in the community that maybe
We
were
did.
doing children's work or work with youth?
Yes, we did, Sheila. We actually reached out and had it was kind of funny the way it worked out. One of the city council members that we invited, she actually she runs a mentoring program for youth in her
Yeah.
community. So that was amazing. And so she brought to the table a lot of great information about the mentoring programs. She's actually planning on when we hold some community events, she is going to help us with those and have a booth there so that she can kind of encourage folks to volunteer and get information out to the families who may need mentoring services. The schools in these communities are amazing, and they do such great with mentoring, but a lot of times having that extra outside in just the community is really helpful as well, because it can reach a lot of adults who may not really think about contacting the school and saying, we'd like to mentor. She has folks that can come in to the schools. Well, before we had the lockdowns, but now that it's opening back up, we're hoping to get that started again, that can come in and have like lunch with the students and have career days where they talk about their individual careers and that sort of thing. So, and then another individual that we reached out to, we did kind of research some other, she's not really necessarily a political leader in the community, but she runs a substance use support program for teens, mainly for like an awareness and prevention type group that they are doing. I know there's a lot out there right now, but the work is so important. And she I think the title of it was Just Say Yes instead of Just Say No. Hers was Just Say Yes to the awareness and prevention aspect of this, to get involved, to advocate for your peers.
Right.
So yeah, we actually had several folks from who were nonprofit, different groups in the community to attend and participate in the survey as well.
Great, thank you so much. I think that really gives people a really good idea of some ways to not only educate about the RIAC, but to get some participation from your community.
Absolutely.
Thank you, Liz.
Thanks, Sheila.
Next slide, please. So think about getting that kind of information in and then wanting to focus, because I think when we deal with kids, I remember I used to think this when I was in practice, you might have a kid and family who had so many needs that you were wondering where to start. And sometimes it feels like that. And I think during this COVID time, especially, we're going to have that problem. So I think that kind of information and discussion that you have in your RIAC can help you decide what's your first or your next step. Where are you kind of in terms of some goals, and what would be a logical next step? And then really hone in on what's needed to make that change happen. You know, we talk about it in terms of the work with Frankfurt legislators. Is this something that needs to happen with a change of law? Is this something that needs to happen with a change of regulation or policy? Is this something that needs to happen because it doesn't have enough money? Those kinds of things. So you could kind of decide what is it that's needed to make that change happen. And then you ask the next logical question, which is, who has the power to change it? And some of these things are going to have to be, if they're really a written policy, they probably are going to have to be done through a city council or through a mayor's office or something. Other things may be done at a much more informal level. And then who do those policymakers, those change makers listen to? And how can you and your RIAC folks be those people that they listen to? So that's kind of a way to outline your next steps, I think. Next, please, Stephanie. So how do you identify your policymakers and community leaders? And Liz has given us some great ideas about this. You know, we tend to think at the top, right? So you tend to think about, well, who's your top official? Well, that's going to be your mayor. Don't forget that you have county top of decision makers. You have county judge executives. So if your RIAC is not only representing those cities and little burgs that have mayors, but also think about your county judge executives, because they have a tremendous amount of power in their county, and that filters down to your mayors. But think about your next levels and your next levels. And sometimes the people that work in those offices, the staff people, some of those top people are really the decision makers. You know, in Frankfurt, it's the Legislative Research Commission people that gather the information and feed it to the legislators. So who is it in your mayor's office or in your city council member's office that is gathering that information? And that again goes back to, if you make that contact and they ask a question that you don't know the answer to, who is it that they work with and listen to, that you can get that information back to them? How do you make connections with them or have someone put you in touch with them? And then how do you stay in touch with them? I mean, one of the things I would advise Liz and her Bluegrass West RIAC is to stay in touch either through emails or an occasional invitation with all of the people that you reach out to, and certainly anyone that took the time to respond with the survey. Even if they didn't join your RIAC, you want to keep them in the loop. You know, you don't want them to feel like, well, I heard from these folks because they wanted something from me and now I never hear from them. So you want to keep them in the loop, because this is really about relationships. I mean, all decisions are made on the basis of relationships. So it's an ongoing process, not a one-time deal. So think about your survey, maybe Liz, as opening the door for you to a lot of people that you hadn't been in touch with. How do you then keep that list going and keep in touch with them, particularly if they gave you some leads to some other agencies or ideas? Next, please. So how do you educate your community about who you are and what you do? And I'm assuming that you all have what I call a fact sheet or a pamphlet or something that describes you. You want to look at it as a good, what I call a leave behind. So anytime that you have a contact, particularly if we're back to making face-to-face contacts, you want to leave something in writing with that person that you've met with. And I will remind you, and it seems like a silly thing to have to be reminded, but be sure your contact information is on it. I cannot tell you the number of legislators that I've met with in their offices, maybe at the end of a day, and they're kind of going through papers that people have left with them and so forth. And they'll pick up a paper and they'll say, you know, I can't remember who gave me this, and there's no contact information on it. You know, so you want to be sure that when people hear RIAC, that Liz, for instance, they have your name and email address on it someplace. You know, I always put at the bottom of fact sheet for more information, contact, you know, and have your phone number if you have a good phone number. Tell your stories, and we're going to talk more about this in a little bit, but the most powerful education is to put a face on the problem. You can have your facts and you can talk about the rises in suicide attempts and calls to the crisis lines and substance use disorders. But if you can tell a story, even an anonymous story about someone, that's what people are going to remember. On your talking points, you want to use bullets, you want to use lots of white spaces, illustrations. If you have a logo that you can use throughout, or you have a color that you use. We find anyway with busy people that they like to be able to pick it up and kind of go through very quickly and get the gist of what you want to say. You hand them a 10-page or a 5-page single-spaced thing that looks like a term paper, and you know, nobody's going to read it, quite frankly. I mean, nobody has that kind of time anymore. And just remember that you're all about the kids. So anytime that you can put a graphic, a logo, a picture, a story that really brings it home about the kids, I think you really grab people's attention. Next, please. So you want to engage in coalition building outside of the RIAC. And again, Liz has given us some great ideas. Who are those kind of unlikely allies? You know, the faith community, businesses. And I don't know whether you thought to go to your bigger businesses in some of these communities, Liz, and ask them what they thought. Certainly law enforcement. When we did the legislative push to do what we call mental health parity in Frankfurt, where we were trying to pass a bill that nobody thought that we could pass to make the insurance companies treat mental illness and substance use disorders like they treat physical illness. We got together a huge coalition, and we had a lot of faith communities on there. We had the Catholic Conference, we had the Kentucky Council of Churches, we had the National Council of Jewish Women, and a number of legislators looked at that and said, how come they're on here? And I said, because what the insurance companies are doing is discrimination against people who happen to have a mental illness or a substance use disorder. This is a social justice issue. And so you got faith communities really getting active around this because it was a discrimination and social justice issue. So think about your issues in terms of who are the people that end up dealing with the aftermath of this, and what are the kind of hooks that you can use in building your coalition to get people engaged. You want to focus again on the ultimate decision makers and figure out who has those connections. So, you know, in Frankfurt, unfortunately, it's very political, and typically people of one political party have more contact than those with the on another political party if they're in the majority, or the same party as the governor, those kinds of things. Hopefully we could stay away from a lot of that kind of politicking at the local level and really think about who are your champions for kids, who are the businesses or the organizations that are organizing backpacks for kids going back to school or collecting school supplies. You know, the people that are stepping forward and doing that are probably interested in some of the work that you're doing on your RIAC. That would be another way to kind of target those people and get them engaged in your coalition. And then you want to build what I call a buzz or a drumbeat of events. And you asked some really good questions, Liz, about events and how many could be in person, and kind of generating media. And I don't know how many of you use social media, but you certainly can follow your local leaders. Most of them have Facebook accounts. Almost all of them are using Twitter these days. And you could learn a lot about your local decision makers in terms of what they post on their Facebook page or on their Twitter. What you want to do is to create a sense that the public is really aware of what you're doing and is really supportive of kids and the work that the RIAC is doing. Next, please, Stephanie. So I love this slide. They kid me that I'm the grandmother or the godmother of all coalitions because I run so many coalitions, but I actually believe that that's the way we get things done. That's why I love the RIAC and the SEAC model, because you are a coalition as a RIAC. And so if you think about the more voices you have all saying the same thing to the same policymakers, the more popular, the more likely you are to get something done. And again, and I know this from Frankfurt to some degree from Washington, but even, you know, at the local city council level here in Louisville, where we're working on them voting down on something that would change the smoke-free ordinance here by allowing cigar bars. And we're getting lots and lots of groups to weigh in on that. The health groups, obviously, lung, heart, cancer, nursing, and so forth, but also some of the children's groups, because the cigars are being peddled with flavors to attract young people to smoke cigars. And it's kind of an end around, and we don't want that to happen. So we're trying to broaden our coalition. So I always think of it as you can't cast a tent that's big enough to put all the people in that care about kids. And again, kids are a huge draw. So if you think, you know, there are grandmother and grandfather groups, there are people that, you know, come together through the church groups and the school groups, certainly your Friskies and some of those groups. So think in terms of building that coalition. Next, please, Stephanie. So your goal is to put a face on the problem. And again, personal stories tell it best. And you all know that you have to get permission and you have to be sure that, you know, a child and a family, you can also tell stories without identifying that because you have lots of stories. You want to have the numbers to back it up, but you always want to lead with a story and put your data in to support the point that your story is making. We've been using little video clips of people telling their story and interspersing those in some of these Zoom meetings that we have with legislators. That's something you might do if you end up having to stay remote, that you intersperse with, you know, a little video clip. And remember that the people that are local are going to influence your local decision makers. You know, all politics are local. Next, please. So I don't know if you all have press conferences, but sometimes that feels very scary. But if you think about who your local connections are in a community, so you have your local paper, sometimes there's only weekly community papers, but they're very important. You have your local TV and radio stations. Some of the communities have local cable stations and you can get interviews with them. We've even done what we call virtual press conferences. So if you have a couple of reporters that you work with and you get a couple people on to tell their story or to talk about an event that's coming up. But most of these local TV and radio stations and your local newspapers are happy to have something to write about or talk about or broadcast about. So think about, you know, building some of that community buzz through those outlets. Calls to actions. So if you have a coalition and you want to get the word out about an event that you're having or something that's coming before, for instance, the city council, people are using emails, obviously, but to alert people, this is the time to make a call to your local metro council or city council members. Lots of social media, lots of Twitter, obviously the personal visits to the policymakers. And again, think about, you want to go representing the RIAC, and then is there somebody in the community that you know is very important to that policymaker that you want to take with you? Don't underestimate op-eds and letters to the editor. Again, your local papers are very likely to print those. I think it's helpful to have a color or a slogan that people hear and hear over and over again. And then you want to utilize the media to keep your story alive, whether it's a vote at the local level or it's an event that's coming up. Next, please. So shifting the narrative is really laying out what's happening now and what the changes that you want to see and why and how it's going to happen. So again, don't forget your weekly community papers, your church bulletins, local radio and cable outlets. Use a phrase that everybody can use in whatever communication so that legislators or policymakers are hearing it over and over again. Let's put kids first, you know, mental health is, all health is mental health, those kinds of things, you know, over and over again. And then people begin to kind of take that in and remember it. Next. I love this map, although I didn't see Danville, didn't make it, Liz. I'm sorry. I didn't.
That's okay. I'm all over the Bluegrass area, so we're good.
Yeah, I know you are. I look for sure to see it. I thought, well, that's too bad after we're talking about, you know, Danville essentially. But I use this because, you know, so often I'm doing state policy, but people just underestimate the power of the local connection. Every elected official, whether they're serving in Washington or in Frankfurt or in Danville, are elected by a group of constituents or local leaders, and you want to be among those people. You want them to know that you're the local person, the boots on the ground, and you're the knowledgeable person about what's happening. So I want to turn it back over to Liz to talk about some very exciting outcomes that she's had in working with those local leaders. Thank you, Liz.
Thank you, Sheila. One thing I wanted to mention that I that I didn't list on here, and Sheila had been mentioning that utilizing media is very helpful. We had one event, and that is on here, is where the local mayor spoke at a RIAC sponsored community event. And the Friskies representative for our RIAC had sort of an in at the local papers, or a paper, and so she invited one of the reporters to come to this event. And because we had invited the mayor and he was going to be speaking, that opened up a lot of opportunity. That they were really interested in attending. The media were. They took several pictures. They interviewed me about the RIAC. So that really was helpful to get information out to the community. And the fact that we had some political leaders there present really helped as well. It drew the media to us. As I mentioned earlier, we used that survey when we were inviting several of the local leaders to attend our RIAC meetings. And that included the mayor, city council members, and like Sheila had also mentioned, we had the police chief was there, which was really, really important because they had seen a lot of an increase in youth violence. So instead of being punitive in nature, we were trying to get ideas of where it was more of a preventative type of thing and an encouragement to identify the strengths of the youth and work on programs in that area. And then we also had school board representatives, which was really helpful. We also had the leaders provided a lot of valuable information. It had helped with our strategic planning on doing community events and different things like that. And then in the event where the local mayor came and spoke, we had a lot of folks from the community come, and they were encouraged to volunteer for local agencies, such as the mentoring programs and local schools. The mayor really encouraged that. He spoke, he did the opening remarks, and then he closed the event for us. So he put his, I guess his weight behind those ideas. And we did have some folks, we had a little sign-up sheet that had different agencies in the community that they could sign up for if they were interested in volunteering for those certain agencies, which we had some folks to sign up that they were interested in volunteering. So the fact that the mayor was there, I think really encouraged folks to attend. And then the RIAC has strengthened its presence in the communities, including increased membership and then the collaboration efforts. So yeah, I think that having these folks attend and be a part of our meetings, and then all of the stuff that's coming from that. And we're not finished. We're going to be, like Sheila had mentioned, we're staying in contact with them so that we can continue to have their efforts collaborated with our efforts, particularly in the community events, and starting up youth councils, hopefully, possibly even trying to have a youth council serve in one of, I'm not sure about all the political aspects of it, but serving on a committee in like the city council or something like that, so that their voice could actually be heard on that as well. So yeah, we're hoping to really delve even deeper into this as we move forward, and especially now that we're hoping to have in-person events. We're going to be inviting all the political and community leaders back to the table with us and attend those events so that we can increase participation and outreach. Oh, and one other one I wanted to mention that I didn't list on here. We, a couple of years back, had an event. Well, they had an event already. We piggybacked off of it in Clark County, and we have a RIAC there, and they were having a homeless day awareness and event. So what we did, we reached out to the Chamber of Commerce, and they gave us, they reached out to all of the people that they had contacts with to ask. We were collecting donations for backpacks for youth who were either transient, they didn't have stable housing, they were homeless, that sort of thing. And we were able to make, I think, somewhere around, I believe it was around 200 backpacks from all of the donations that we received from those community members. And it was just people, just because we had reached out to the Chamber of Commerce, and she put the word out that we were needing this, and then the word spread. And we were able to get a lot of good done with no money even, because it was all donations. So just as Sheila has mentioned before, don't just limit it to the top, because you can really research in the community and reach out to a lot of folks who are very willing and happy to help, and good things can come from it.
That's great, Liz. And I love it that you got your local paper. I wonder if you feel like that reporter maybe would look to you all as a resource. I mean, to me, one of the ways of being an advocate is to get yourself established as a resource for the media or a resource for your local decision makers, so that if an issue comes up about youth, you know, maybe that reporter is willing to get back in touch with you to ask you for a comment or whatever.
Yeah, I hope so. I do. I can say that, and I don't know if it came from this or not, but after that event, a lot of folks started reaching out to us, asking more about our RIAC and, you know, what we did and how we operated. And I think we may have gained a member or two from that because it was out in the community. And we also used papers and the social media to thank community members, to follow up and say, you know, you all are valuable to the work we're doing. So I think it allows more community engagement as well.
Yeah, I just had a thought, and I don't know whether any of the RIACs have ever thought about this, but I wonder if a RIAC had an event in let's say Danville, and you invited Representative Daniel Elliott, who is your state representative, to come as well as the mayor, because my guess is you would get more media coverage.
Yeah,
we're
hoping to do that now that we're trying to get some community events and work with our local ASAP boards as well. Because one of our projects in the South RIAC is to hopefully have some youth-led programs, which will include community events. So now that we're able to hopefully get back into in-person activities, I think we'll be reaching out to those individuals, definitely, and asking them to participate.
Well, the other thing you mentioned, which I think is a great idea, Liz, is to take advantage of events that are already going on. So, for instance, September is Substance Use Disorder Prevention Month. So focusing on and seeing whether there's your local ASAP groups or whatever. That first full week in October is Mental Illness Awareness Week. And if you have an active NAMI, National Alliance for Mental Illness chapter, they in all likelihood are having some kind of an event that week during MIAW week, and drawing attention to youth who are really struggling with mental health issues might be a good partnership kind of thing too. So that that might work for you as well, just as another idea. So thank you very much. And I think we're at our last slide here, Stephanie. So this is my favorite quote of all times. I always end my workshops with this because I think it is so true. Never underestimate or forget that a small group of thoughtful people can change the world. Indeed, that's all that ever has. And I am just sure that the RIACs are that small group of thoughtful people. So I think we have time for some Q&A or any questions, if any have come in the chat, or if anybody wants to ask any questions of Liz or me, or give us some suggestions about how this could be a better presentation, more helpful to you.
There are no questions
Friday.
in the chat. There are no questions in the chat, but I just want to say thank you both for being with us this morning. This was excellent information. And I know that I've got several takeaways in my mind from the information that you all provided. And, you know, one being, you know, making sure that, you know, that the people that we're trying to reach, they know, you know, what they understand what it is that we're asking. Because I think a lot of times, you know, where we do this work, we take for granted that other people are on the same page as we are. And so sometimes I feel like, you know, we've got to take a step back and we've got to meet people where they are, provide that education, and then bring them along with us. Sheila, I loved what you said too about about taking the second bite of the apple. You know, it's not a one and done. If we don't know the
Right.
answer to something, sometimes we've got to dig in a little deeper and find that answer. And it's okay to not know the answer to everything.
Yeah, it really is. You know, I've been going to Frankfurt since 1978, and I still get asked questions that I don't know the answer to by legislators. And I have learned, you know, it's a great opportunity to say, hey, that's a great question, and I don't have it right now, but let me get back to you with it. I think there was somebody, maybe a male voice had spoken up. Did somebody have a question?
Yeah, this is Donnie Ray. I was just going to say that it was a great presentation. I always like to remind those politicians that we are the ones that put them there, and if they enjoy what they're doing, to help us accomplish what we need to get done. Of course.
Well, it is, you make a really good point, Donnie. And I always say to people, you know, 138 legislators probably know me, know my name, but I can only vote for 2 of them, 1 House member and 1 Senate member, and re-elect them. So you as a constituent have all the power, and never underestimate that. And particularly if you're a registered voter and if you vote regularly. You know, politicians have gotten really smart about checking the polls. They're not in the polling booth with you. I don't want you to think that they know how you voted, but they will know whether you're a registered voter, and they will know whether you're a regular voter. And you carry so much weight as a constituent for that reason. So thank you for that point. It really is a good one.
During this pandemic, it's been tough because we can't do our job like we need to from our desk.
Yeah.
We can make all the phone calls, but when you show up in somebody's office, it's easier for them to talk to you and you talk to them. I mean, they can just avoid the phone calls. So
I will say, Donnie,
no.
Yeah.
Donnie, you're right about that. I know that I didn't really mention this, but it took several different times of points of contact for me to get folks to respond the first time. So I think it's important to kind of include, when you're contacting them, ways that you can help them as well, that we're not just asking for their help, that we're telling them, hey, we're here to help you as well.
Right.
In
Right.
that. So.
That's it.
Yeah, it's a good point. And I agree with you. Trying to advocate during the last legislative session remotely was so difficult, because I know where they hang out. I know I can catch them coming and going to committee meetings. They know who I am, and just seeing me sometimes will remind them that, you know, they owe me back an answer or a phone call or whatever. And when you're not there, it is very, very difficult. So for so many reasons, I hope that we can all get back to something that resembles, you know, face-to-face contact and so forth while being safe. But you all do such great work. Never underestimate the work that you're doing in your local communities, and be very proud of that. I just think the RIACs are really the backbone of so much of what's going on that's good for kids and families. So I thank you for that. And thank you for the opportunity to talk with you this morning.
Well, thank you both again for being here today. Also want to just remind everybody that our next RIAC Learning Series is scheduled for September the 3rd at 10 a.m. Eastern Standard Time. And the topic is youth connectedness. And our presenter is LaDonna Butler with Enriched Families. So we hope to see you guys back again then. Thank you for your patience today as we kind of worked through the challenges of the Zoom link. And thank you to you guys that sent that out to your members to make sure that they had access to this. So again, this recording will be shared on the RIAC webpage, and we'll send that out through email too, just to let you all know so you can share that with your members that weren't able to attend. So thank you both again. I hope everyone has a wonderful weekend.
Thank you all, and thank you, Vanessa and Stephanie and Liz. It was a pleasure to present with you.
You
Bye-bye.
too. Thank you.
Great job, Liz.
Thanks, Donnie. Hope you all have a great weekend.
You all too.
Bye-bye.
Bye.